Many of the trips that I've gone on, it's been a dental hygienist, me. But there are so many things that we can bring to the table within our clinical skill set. But I would say, in my opinion, the most important thing we bring is education. That is key if we can help the families, help the kids, provide that education for lifelong dental health. That is really, I think, the most important thing about it. I have to say that's one of the things I love about these trips the most is that you're one team and everybody has value. There's somebody who's the sterilizer, there's the photographer, there's a medical records keeper, so there's non-medical, roles as well, but everybody is equal. So it's really, really great when you can see the child before the surgery, during the surgery, waking up in the PACU, and then the smiles on the parents' faces. That is like gold. It is just gold.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists podcast, an Endeavor Business Media production. This is episode number 398, and I'm your host, Andrew Johnston. Thank you so much for joining me today. We have Mary Jensen. She's our guest this week, and she walks us through her recent experience doing a dental and medical mission trip to Vietnam. Mary has gone with the same group to places all over the world, and I just read something this past week that said something to the effect of, and this is probably a little bit wrong, but 50% of the Americans that are going on vacations or tours are going overseas this year, which I feel like that's a bit high, but maybe it's true. And if that is true, then at least half of you are probably going to really love this episode, because we do talk a lot about travel. We do talk about her adventures overseas, both with Vietnam and several of the other countries that she's been in. But this is an opportunity for her to go and serve mostly children. But in this episode, we also learned that even adults are treated, those with cleft lip or cleft palate. So it's a good episode. You're really going to love it. It's a little bit different than what we've had in the past. And then next week, we will be doing our roundtable. It's the first episode of the month. We're going to try and bring back our roundtables for these episodes. I have Debbie Z and Lysandra Masonette joining me for this episode. And in this one, we have a discussion that's kind of a callback to an episode we did a few months ago with Dr. Ben Holbert when he was on the show. And we're going to be talking about what it's like working with a new grad, and specifically a new grad dentist. Debbie Z and I have probably similar backgrounds, but when it comes to employing a dentist, I think Lysandra has the most interesting take that you'll ever have. So make sure you come back for that one. And I know I say it often. I think it's worth repeating often. Please be sure to hit that subscribe button, share it with your friends. We're only 3 ratings away from 200, so it doesn't take but a second. Go hit that 5 stars on your Apple Podcast app, and I would really appreciate that. 2 last things before I finish up and we go to the interview. I did more investigating into the letter that I mentioned on last week's episode, the email that I received. And in trying to find out if this is legit or not, I received no replies that was making me think otherwise. And I kind of feel bad because I'm hoping that this was something that we could help someone with, but I just wasn't getting the confirmations that I need. So right now, I think I'm just going to drop it for now. If I hear back soon, I'll bring it up on the show. It might be next week. It might be in 2 weeks. It might never be. I'm not really sure, but I just wanted to come back and finish that thought with you all. And then shout out to Laura, or maybe Lauren. It's been several weeks, and I meant to say this earlier on a previous episode, but she's the hygienist down the road where I took my oldest son for his dental visit. She is just a few years out of school, but she seemed to be pretty darn on top of it. She has all of the gear. She has the iTero scanners, the Dentsply Sirona Cavitron, mouthwatch camera, nothing that was really like run down as far as equipment. She had, I think it looked like a mix of PDT and Hufredi instruments. But the thing that I have known is that in a lot of times when you have these offices that have all the gear and all the tech, those offices also expect you to use all of the gear and all of the tech. They expect the radiographs and the scans and all of the everything in these new patient appointments. I was told 90 minutes when we checked in. So it sounds like an hour and a half for new patients, which is awesome. But it really was only about 70 minutes from start to finish. Now, Zach is not quite 17, But even then, I thought that was pretty darn impressive of her to be able to do all of that and not complain about what she was asked to do. She didn't complain about the fact, because I did ask about the scan, and she wasn't, oh, this is so terrible. Oh, it takes so much time out of our day. No, it was like she was excited about the technology. And I think above and beyond all of that, it was a 7 a.m. appointment, and she was absolutely pleasant to be around. So if that's what our recent grads are all about, I think this profession is going to be in great hands. So thank you so much to her. Again, I'm really sorry I forgot your name, but thank you. I think you're doing a great job. I don't think she listens to the show, but I want to give her a shout out anyway. Okay, well, that is it for me. Enjoy this episode with the marvelous Mary Jensen.
A tale of two hygienists.
All right, welcome everyone into the interview portion of the podcast. I am joined by Mary Jensen. Mary, it has been, we were just counting before we came in. I think this might be episode number 4 that you've been on with A Tale of Two Hygienists. Welcome back, buddy.
Well, thank you. This is great. I mean, to be able to come on 4 times, I love it. Thank you so much for having me.
Well, I mean, it just goes to show, I think, you have so much to give, so much to offer for our audience. The topic that I wanted to kind of drill into today is, I was scrolling Facebook, as we do, and I had seen that you were in Vietnam doing a trip.
Yes.
And this isn't the first time you've done these types of trips. And so I wanted to kind of lean into this one a little bit more, because it's about cleft palate surgeries from what it looked like. But let's dial back. Let's go back to the very beginning. Like, how did you get involved with this trip, and who's the organization that you go with?
So the organization that I've done all of my mission trips with is called Alliance for Smiles. And they are based in San Francisco. They're a nonprofit. And they were started by 5 San Francisco Rotarians. Rotary International is it's a worldwide service organization. And these individual Rotarians had done previous work with other cleft lip and cleft palate organizations, Rotoplast and groups like that. But they wanted to have a twofold organization. They wanted to provide the cleft lip and cleft palate surgery to underprivileged children around the world free of charge. But they also wanted to set up teaching hospitals or teaching centers. So the missions are all about teaching as well. And it was, 18 years, I don't know how many years ago now, 19 years ago, the dentist that I was working with was a Rotarian. I'm in the Chicago suburbs. And he went on the very first trip with Alliance for Smiles. And he came back and he said, oh, well, the dental hygienist. And I said, what do you mean there was a dental hygienist on this trip? I was like, what? I had never in a million years thought I could do dental hygiene on a mission trip. So sure enough, the ball got rolling, and, the following year I went on my first trip, and that was to China. And consecutively every year I've done a trip. COVID obviously shut the group down for a couple of years, like with many organizations, but they're back up and running. So that's a good thing, right? We're all back up and running.
Yes, that's right. So the organization, are they really into this one niche of dental trips, or do they do big picture, broad spectrum, like everything for dental? It is solely
the sole purpose is to provide the cleft lip and cleft palate surgery. So the dentistry kind of comes in on the side,
Sure.
Sometimes there's a full dental team, a dentist, a dental assistant, and a hygienist. Many of the trips that I've gone on, it's been a dental hygienist, me. But there are so many things that we can bring to the table, as you can imagine, within our clinical skill set. But I would say, in my opinion, the most important thing we bring is education. That is key if we can help the families, help the kids, provide that education for lifelong dental health. That is really, I think, the most important thing about it.
Let's dive into that a little bit, because one of the things I feel like I see, I don't want to say it's my generation's fault, but I feel like it's with my generation specifically, is when we're going on dental mission trips, we don't want to give education. We want to get in there and treat. We want to get in there and scrape. We want to get in there and do the thing. Tell me what that looks like as far as giving the education. Is this just all day lectures? Is this going, person by person giving education? What does that look like?
So it depends, mission to mission. It depends who else is with me. So I'll just use this most recent one, Vietnam. I was just in Vietnam, the end of June, beginning of July. It was a 2-week trip. So just to backtrack a little bit, on the first day, all the families come, with their child, and they're screened. So they're registered, they're photographed, they're weighed and measured, their hemoglobin is checked. They see a surgical team. So they're seeing the plastic surgeon that's going to provide the surgery. They see the pediatrician, for a wellness exam, and then dental. And so I'm not doing a sit down, mirror and explore exam. I'm looking for abscesses. I'm looking for anything that I would need to alert, the medical staff about. And I'm also gauging what am I going to be doing in the dental clinic? Are there teeth that I can seal? Am I going to use some silver diamine fluoride? Obviously, I'm going to do a prophy. I'm going to do, fluoride varnish. So when I have the child there in the clinic, and I always have to see these kids prior to their surgery, because once they're operated on, I can't go back in their mouth. As you can imagine, you've had a cleft palate surgery or cleft lip surgery, doing anything. So they're with their parent. So I don't just do the education for just the child. I mean, the child is the center of the focus, right? But it's also the mom or the dad or the grandma or the grandpa, whoever happens to be there with the child. And then I always try and send home toothbrushes for everybody that lives in the household with the child. Because I have learned that many times in many of these very underprivileged areas of the world that I've traveled to, the family is sharing a toothbrush.
Yeah.
And it's not uncommon. And so if I can supply a little education with mom and a little education with the child, and then supply all the toothbrushes, they can send that home and, information. So what exactly am I doing with the education? I have books. I have, obviously the tooth model. When they're sitting in the dental chair, it's their first time in a dental chair. Now, I'm not going to just go gangbusters from the start. The first thing we do is we read a couple books. And even though they're in English, I have translators with me, and they're picture books. So they're very self-explanatory. And then I have them show me how to brush on a model after I've shown them. And then I have them brush their own teeth, and then I show. So, and it's a long process. This takes a long time, but the goal is that they realize that they really need to do this in the morning and at night before they go to bed. And many places it's just once a day. It might be morning, it might be night, but the thought of even brushing your teeth twice a day is kind of a new concept. So you go in gently. You don't go in shaking your finger and, why are you doing it this way? You go in and you guide and you say, you might want to think about this, because I see a lot of decay. Oh, a lot.
I was going to ask, do they have access to toothpastes like we have access to toothpastes?
They do, if they choose to buy it and if they can afford it. That's another whole thing. And I don't bring it with me just because of the weight. I know you've done mission trips, Andrew. Every ounce in that suitcase is like prime real estate. And if I brought, 50 even small tubes of toothpaste, it would take up so much weight.
Yeah.
And, people are like, well, what about flossing? And I'm like, you know what? We got to start at the beginning. And if they can't buy it, it's not that I don't want to waste my time on that. Of course but you got to start small and go from there. I just want them to realize that their teeth have to be healthy for their bodies to be healthy. And the way to prevent tooth problems is by really good, home care, really good oral hygiene care. So
it's been a long time, I think, since we talked about it on the podcast, but for a long time, I felt like, every few months, like dry brushing would come up in the conversation and how important that is. I mean, if you have nothing, do the best you can, right? That's
exactly.
Do what you can to get there. For these patients, okay, I kind of want to walk through like the intake of it, because obviously they're children, probably younger children, but is there an age limit that you all are working with?
No, as far as the kids, they'll, 18, 19, but we've also seen adults, but the organization really focuses on getting those kids done, before the adults. But I mean, the youngest, can be 6 months old. It's really based on what's the problem, how severe is the cleft lip, what's the health of the child. There's a bunch of different parameters that go around that. And then, how many, they really want to get as many kids as they can get in. During the 2 weeks there. It's really 8 days of surgery, because we do take one day off in the middle. So it's a real wide range of babies, toddlers, all the way up to teenagers. But I had on my one trip to Ghana, we had a 54-year-old woman who had a unilateral cleft lip and she wanted it repaired. So the very last day they had space for her and they did it. It was amazing. She was thrilled. She was thrilled to have it done. Yeah.
That's
right?
amazing. No, I mean, it is. I was just thinking, and I guess this would be also true with, little, like smaller children and abscesses, but what are some of the things that would disqualify? So for example, these 18, 19-year-olds, assuming that they, are just more predisposed to having some issues. Maybe they do have abscesses, or maybe they do need like a scaling and root planing, like real periodontal therapy before they go in? Or do you say that more important to have the surgery and then we'll come back and do the SRP later?
Exactly. I don't want to say there's no perio being done, but I'm not there if that ever occurs. Mm-hmm. And I certainly don't have time to do that. So if there's an abscess, if I see, I'm diagnosing, we're loosey-goosey here, right? If I see something that didn't look quite right, like a pimple at the gum line, I'm going to alert the nurse we're going to talk with the plastic surgeon so the surgeon can see it. Because certainly if it's anywhere near the area that they're going to be doing a palate repair, they need to know that, ahead of time. If it's not they're doing just a lip, and many times they will prescribe an antibiotic. There are some plastic surgeons who will do extractions and some won't. I've been on many trips where the dentists have just, they've done tons of extractions. So it's all over the map. So the thing that will cancel a surgery or have a child not be a candidate for a surgery is upper respiratory issues. Mm-hmm. Or if they hear the pediatrician he or she is the last person that says yes or no. It's not the anesthesiologist. It's not the plastic surgeon. It's the pediatrician who's on the team. And if they hear, something irregular with the heartbeat, or if there's an upper respiratory thing going on, done, and obviously their hemoglobin has to be at a certain level. And so there are medical things that will cancel out. And then on our first trip back to Guatemala post COVID, it was, all the testing, that was, as you can imagine, getting them tested right before surgery and, but they did it. We did it. Now that's kind of gone by the wayside a little bit more. Did that answer?
It did, but I got sidetracked because you're like Guatemala, and I'm like writing down, okay, Ghana, China, Guatemala, Vietnam. Just as a quick side note, how many countries have you been to now?
Okay, so I've been to China 8 times. I've been to China. Don't ask me the cities because it's just all over, right? I've been to Myanmar, the Philippines, Zimbabwe, Ghana, Egypt, Bangladesh, and Vietnam, and Guatemala. So, yeah.
Holy moly.
Yeah.
What does it look like?
I hope next year to go to Ethiopia because they've just set up. I really want to go there. I really want to.
How do they determine which place is going to be next?
So all the worker bees in the organization, many of them are Rotarians, and they work with other Rotary groups that are looking, that are working with the hospital, that are looking for a group to come in and provide these surgeries. So there's certain people at the organization that will go do the site visit. So we don't just like show up, hey, we're here, They have to do a site visit, and they have to make sure that there are a good number of kids to provide surgery for, because you don't want to bring a team of 15 to 20 people over and then find out, there's no patients, that would not be good. So there's a whole other groups of people that are responsible for that. And most of the work on the ground, the boots on the ground, is the local Rotary Club. It might even be 2 clubs that are working together to, coordinate where the family's staying the night before their surgery, who's providing transportation, meals. I mean, all that has to be coordinated. And then we're basically taking over an operating room in their hospital. We use space in their post-anesthesia care unit in the PACU. We need beds in the ward. We need a dental clinic, preferably, so there's a lot of moving parts. So every team, every mission has a mission director.
Mm.
And many of those mission directors have done many, many, many missions. So it's a well-oiled process.
I bet.
And you have to have systems. Like everybody knows, like, this is how we do it. And not that it's not open, for discussion if you think there can be improvements, but everybody kind of has to be on the same page to make it work. And egos are checked at the door. You're not allowed to have an ego. Everybody's on a first name basis.
Yeah.
And you're one team. I have to say that's one of the things I love about these trips the most is that you're one team and everybody has value. There's somebody who's the sterilizer, there's the photographer, there's a medical records keeper. So there's non-medical, roles as well, but everybody is equal. It's great.
I've loved that. Like, cause the places I've been to, not nearly as extensive as you have, but like when I go there is more of a camaraderie. This is the objective. We're all working together to achieve this goal, which I know technically in dentistry, that's what we're supposed to be doing, right? We have that one patient and we all are supposed to work together to do that. But then the financials come into a part of it. And then there's the whole psychologies and all these other things that come into the offices that kind of ruin that ability. But you're right. I mean, there's nothing like we're all on the same page. We all have our skills set. Let's all just, work to the top of our scope of practices. Let's do all these things. I love it.
And I love too that dentistry is a part of this medical mission trip. And I'll get questions from the medical, the anesthesiologist, from the pediatrician. I'll get questions on dentistry because we're still kind of like behind a curtain, what are you really doing with these kids? Well, have you ever heard of silver diamine fluoride? And they're like, what's that? So it's like, it's a great opportunity to kind of explain all the things that we can do basically at minimal cost, really, when you think about it. It doesn't cost a whole lot of money to do dental hygiene care on these mission trips. And it's a nice way to, it's promoting our profession, which I feel very strongly about. Yeah.
Yeah, the interprofessional collaboration with
absolutely
these people. We did an episode just recently with a cardiologist that's going to be coming out probably probably a couple months after this one actually airs. But it was really good. I mean, it was a high level overview, but in the conversations that we had with them afterwards, it's like, holy moly, like you're right. We should be working together more. So I can't wait for that episode to come out. A little teaser for everybody. You mentioned earlier some you have to have systems in place. You mentioned. And I was wondering if you could talk a little bit about the systems of sterilization. You guys are working at a hospital, so this isn't going to be the same as what everyone experiences on dental mission trips. But what was your experience for like sterilization process?
So it's been different on every mission trip. But in Vietnam, I was fortunate to have like a separate side room that had like 2 chairs in it, and the dental clinic was like literally around the corner and it had many chairs in it, and they sterilized my instruments. So that was fantastic. I was able to, put them in where they then took them and sterilized them and then returned them to me the next day. There have been trips where I've brought them to our team sterilizer and they've done them with the lip and palate setups. They've just separated, I have them separated and they do it that way. So each trip is a little bit different. This was really nice just to have the dental clinic do it, because then I'm not transporting to another part of the hospital and bringing it back. It was all in one place, which was really nice. So,
well, that is nice.
Yeah, that worked out great.
I wonder if before we get into, because I know that people are going to want to know about like costs and like, time commitments and things like that, all the good stuff. But before we get into that, I would love to spend more time on just the surgeries itself. Have you ever had a chance to observe one? Or, because a lot of us don't know what like a cleft, actually, honestly, a lot of hygienists probably haven't seen a cleft lip in person or a cleft palate in person. So what does that look like and what are they doing for the patients?
So believe it or not, a unilateral or a one-sided cleft lip, that's a 45-minute to an hour surgeon time. Mm-hmm. But a cleft palate, if it's big enough, if it's a large palate, a big opening, that can be a 3 to 5 hour surgery. That's quite extensive. Wow. So what they will try and schedule the very first day, they'll only do lips, because you have to realize all of these team members in the surgical, realm, they're getting used to working with each other. So they're going to, I'm going to say keep it simple. I'm not saying that those surgeries are simple, but they're easier than they doing a palate. They'll do lips only. And then as days go by, the surgeons like a little break. They like maybe a palate, then a lip, then they like to kind of break it up. But a surgeon can do anywhere from 3 to 5 surgeries a day, depending on the length. So the surgical team is the anesthesiologist, the plastic surgeon, and then there's an operating room nurse. And usually the local hospital, this trip in Vietnam, it was many of the dental students were coming in and being, scrub nurses with the plastic surgeons. So they're teaching as they're doing it. They're kind of teaching as they're. So I have assisted in surgery. I've had surgeons show me how to do it. Obviously, as a dental hygienist, we're not afraid to go in the mouth. Right. We're pretty comfortable doing that. I mean, I've been a hygienist for 42 years. I'm not afraid to do that. So actually, I love that part when I would be done with the kids. If I knew the surgeon from previous trips, or if we had a rapport from another trip or something, Mary, come on in. I need your 2 hands. So then that left the scrub nurse to do the instruments, to pass the instruments. So sometimes I'd be retracting, I'd be suctioning, and I love that. The dentist that I did most of my trips with, he preferred to do all of his extractions in the operating room. Why? Well, the child's, sedated.
Right.
I mean, who wouldn't prefer that, trying to do these extractions in a dental clinic? So assisting extractions, I mean, I love all that. Because I don't get to do that here. Right. I don't get to do that on a daily basis. So, but I did ask questions on my very first trip. I didn't know the first thing about being in an operating room. I had no idea. And I went to the lead nurse and I said, Annette, show me the do's and don'ts. And she did. And she was really nice about it. And, since then I've coached other people coming on trips, like, okay, these are the do's and don'ts when you go into the operating room. So it's really, really great when you can see the child before the surgery, during the surgery, waking up in the PACU, and then like the next day in the ward where, these kids recover. They're just like, like it was nothing. And then the smiles on the parents' faces, that is like gold. It is just gold. So I feel very fortunate that I'm able to, as a dental hygienist, to step into that medical world. I know it's a unique situation, and I feel really lucky to be able to do it. I love it.
Yeah. So it sounds awesome. I'm like you though. I wasn't, with this one doctor I worked with all the time, and he loved doing like extractions and surgeries, and he was, as a general dentist, not afraid to remove tori, like that kind of stuff. He just loved it. And so I'm like, all right, I will assist you at any point. And I loved it. It was just because it's different, right? It's a shake up from the norm. One question I'm sure someone's wondering though, because post-op infection is always something that we're conscious of. But it sounds like this trip, though, they have a hospital system to rely on just in case. Are there ever any issues like complications post-op?
They're of course, given that the organization has done over 7,000 kids. So you can imagine just the statistics alone are going to tell you that has somewhere along the line a child on a cleft palate had a bleeder, where it's maybe opened a little bit. Absolutely. So there are safeguards put into place. Every child is checked before the surgeons leave. And then there's a different on-call team because we're all staying at the same hotel. And so there's the pediatrician's always on call, then an anesthesiologist, an operating room nurse, and then one of the surgeons is on call every night. And interesting, like in Vietnam, we had a bus that took us to and from the hospital. It wasn't walkable. Not that the distance was too far. It's just too much traffic. And as you can imagine, motorbikes.
It's chaos. Traffic.
It wouldn't have been safe for us to walk.
Yeah.
So the bus driver of this bus actually stayed at the hotel. He had a room because if the surgeons got called in the middle of the night, well, somebody's got to get them there by bus. Yeah. So there's all these, safeguards, and they have, obviously nursing staff that's with, the post-op kids all night. So there's, like I said earlier, there's a lot of moving parts. There's a lot of, checks that you have to have. So yeah, I mean, I couldn't tell you how many, post-op, things that they might have had, but there are definitely procedures in place to take care of that for sure.
I love that. I love it. All right, you ready to get into the nitty gritty? This is what most hygienists are going to want to know. They're like, okay, how much is it going to cost me? How much time do I have to stay away? What do the accommodations look like? You mentioned that you're staying in a hotel. So just as probably a blanket cover, all trips are different costs?
All trips are different costs. Okay. So with Alliance for Smiles, if you're a medical volunteer, and dental is included in that because we are considered medical. Yeah, mm-hmm, right. Mm-hmm. Your room and board. So your meals and your hotel costs and your international airfare is paid for. So they fund these trips mostly by Rotary International grants. So they're getting grant money to send a team to, say, Vietnam to provide these cleft lip and cleft palate surgeries and to do, the teaching along as well. So, my airfare, my room and board, and my domestic flight, I had to pay. I had to fly to San Francisco for the initial leg. So that, sure, that I covered. There's a registration fee, which includes your traveler's insurance, which, Andrew, I'm sure you realize how important that is, because if you get sick, you want to usually fly out, and it's mandatory that you purchase, even if you have it on your own, you purchase it through the organization. So then everybody on the trip has the same insurance, and there's no question about.
And it's not expensive. It really isn't. I mean, I think when I went to the Philippines last time, I think it was like $60, $50 for a week and a half.
Yeah, it's not outrageous.
Yeah.
There's certain immunizations they require is
sure.
They want you up to date on your Hep A, your Hep B, and your COVID. Absolutely. Mm-hmm. And if, I would get flu, you get all the ones to cover all your bases. You don't want to get sick on a trip. So that's all covered. When people ask me, how long are you gone? I always say 3 weekends. Because if I say 2 weeks, people are saying, Monday until the following Friday. No, because you've got travel days. My travel to Vietnam, door to door, when I left my house in the suburbs here of Chicago, till I walked into my hotel room in Vietnam, was close to 40 hours.
Sounds about right.
Right? Because, you got a layover in San Francisco.
Because you're meeting in San Francisco, which takes a little bit of time. Like you're going to build in a buffer time too, just in case your flight gets delayed from, Chicago or whatever. So yeah. So that you need to have a big block of time. And then I wouldn't plan on anything major that first week you're back because you are jet lag. I mean, the jet lag is pretty bad. Mm-hmm. You're tired, but of course, it doesn't stop me from going. I love it. So out of pocket, you're looking at less than $1,000 usually for this particular group.
I would say so. And then, just any spending money you want, when you're there, you get a 1 day off. They take us somewhere, cultural or, someplace unique to the area. And I'll go back to Vietnam again. They took us, we got up at Ojark 30 to do the floating market on the river. That's where I know you know what I'm talking about.
I would love to do that.
Yeah. So you get up early because you're never going to be there again. It's like, so we did that. And then the city we were in was about a 4-hour bus ride from Ho Chi Minh City, which used to be Saigon. And in the Mekong Delta, it was called Kanto. And we had a wonderful Rotarian who was a college professor, and his specialty was the environment of the Mekong Delta. And we went like deep in where they grow the grasses and they dry the grasses and then they make the baskets. And it was awesome. We had lunch.
Lucky.
And I know it's like when you get to do things like that, you're like, oh, pinch me, here I am in Vietnam getting to do this. And everybody is pretty much of a like mind of, let's travel. Let's see what we can see. Let's do it. So going back to breakfast and dinner you have at the hotel, and the hotel ranged, as you can imagine, from low to high, but I'm pretty basic, my husband and I, we camp. So like, hey, it's like, I'm good with, comfort, just basic comfort. And then at the hospital during the day, they bring lunch in for everybody. So you were definitely well fed, and the food was amazing in Vietnam.
Was it local food or was it hybrid?
Local food. No, all local food. It was so good, and plenty of bottled water. I mean, I think they delivered a case of water to my hotel room. I mean, because as you know, Southeast Asia in July is hot and humid. So you're drinking plenty of water.
Yeah, absolutely. Oh man. Just, I mean, the local food itself would be like the reason to go.
It was delicious. I loved it. So it was a real fusion mix. Yeah. It's because you have the Chinese, you have the French influence, a little bit of an American influence, and then the Vietnam. It's like all this. Oh, it was really good. And everybody, and I'm like, no, I would definitely say it was probably the best food I've had on a mission trip.
Wow.
Yeah, it was really good.
So you get the one day off. Do they allow you to maybe come in or stay later if you wanted to add more days to vacation?
And I did that a few times because I was traveling with coworkers, and we went early into China. Like we went early into Beijing so we could do the Great Wall. We went early in to go to Xi'an to see the Terracotta Warrior soldiers. I've done that on other trips, but this trip, it was just go and come back. So, and that's fine too. You still get a real flavor of the local, we had an extra night in Saigon before flying back. So we were able to go out to dinner in Saigon. There was about 5 of us. So yeah, that worked out really good. I will say I'm vegetarian. But so I was just like all the delicious vegetables and tofu and the fresh fruits, the mango. Oh, I mean, it was just so delicious. So I loved. I'm sorry, you're getting hungry, aren't you, Ann?
And you're making me like mango. Well, and the Philippines actually does have the best mango in the world. So I don't want to start a turf war here with all the Vietnamese listeners, but yeah, the mango. Oh my gosh, to me that's a reason to visit Southeast Asia by itself. And everyone's like, "Oh, I hate mango." I'm like, you don't know what you hate. Just hang on there. Hold on to your hats there.
I know.
Look, I mean, I think. What's that? 6 more questions I have. We don't have any more time to ask any of them, but let me ask this. Is there a question that you think that the listeners were wishing that I would have asked? Is there something we didn't cover that you wanted to share with them?
I would say if you're thinking about doing a mission trip, whether it's, in this country, or abroad, is to really look at the organization. What is their mission statement as an organization? And how are you going to fit into that mission statement? You want to be able to stick to your realm, your scope of practice, and then find out where your skill set fits in with what they need. I think we talked about it when I was on the podcast a few years ago. I would say these mission trips, because they're time sensitive, I only have the child for a short amount of time before they are probably having surgery that afternoon or maybe the next day, is that it's not time to be slow. I'll just say that. It's like, I would say, maybe have a few years experience under your belt in private practice before diving in. You've got to be like really at your high level, of clinical expertise and being uncomfortable. Like you have to just be comfortable with being uncomfortable. It's a different language. Everything is different, and you just have to be prepared for that, I would say. But do your homework organization that you want to go with, just so you know that you fit the need that they're looking for.
Gosh, we're going to talk more about that off air. That's beautiful advice. Mary, thank you so much for being here. Alliance for Smiles.
Alliance for Smiles, yeah.
I'll put the link in the show notes if you guys are interested. And Mary, if they wanted to reach out to you, ask any follow-up questions, where can they reach you?
Sure. My email is Mary Jensen, MaryJenscn, RDH @gmail.com.
And that will also be in the show notes. Mary, thank you so much for being here.
All right. Thanks, Andrew. It was great.
Yeah, this is a tale, oh yeah, a tale of 2 hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of 2 hygienists.